Every single day, countless older adults take prescriptions they've been assured are completely safe. Yet some of these very same drugs may be silently affecting their recall, their attention, and their cognitive well-being as time goes on. Every minute and 6 seconds, another senior receives a diagnosis of cognitive decline. By the time you finish watching this, roughly 20 additional households will learn those words. And here's what troubles many of them the most. In a significant number of cases, the real culprit wasn't their age at all. It was something sitting right there in their bathroom cabinet, a medication they were told to trust completely. I'm Dr. Alan Mandel. Having practiced for well over a decade and a half, I've witnessed this scenario repeat itself far more often than I should. Someone who was mentally sharp throughout their entire life begins slipping. They can't recall faces, they miss scheduled appointments, they take wrong turns on roads they've traveled countless times. Their loved ones chalk it up to getting older. That's rarely the truth. It was the medication. Something that practically nobody questions because it came from a healthcare provider and was filled at a pharmacy. Here's what the latest science keeps revealing. One common everyday medication category can seriously compromise both memory and cognitive performance inside just 12 months. Yet the vast majority of people taking it have absolutely no awareness this is occurring. Today, I'm going to show you the 9 medications most frequently connected with serious memory deterioration. I'm counting down from the ones people often overlook completely to the one I believe poses the biggest threat to brain function. Pay special attention to number 3. It's administered to millions of older people for something that seems totally benign, and it might be quietly affecting your brain's memory regions right this very moment without showing any warning signals. Now, before we dive in, I want you to share in the comments section, what's your current age and which medications do you take regularly? I make it a point to read these, and knowing who's watching helps me decide what to focus on next. I want to tell you about something that could genuinely transform how you approach your health as you get older. If you're concerned about maintaining your independence, protecting your balance, strengthening your lower body, and reducing your fall risk, there's a complete system you should know about. It's called Stand Strong, the doctor's fall-proof method for life after 70. This is a practical guide I've created that goes far beyond what any single video can cover. It walks you through proven methods for building stronger legs, improving your stability, and maintaining the mobility that keeps you independent. While this video shares some of the most important insights, the ebook provides the full step-by-step system with structured routines you can implement immediately. Thousands of people have already grabbed their copy, and you can access it using the link in the pinned comment or in the video description. It's designed to give you everything you need to stay strong and fall-free. Now let's get into the information you came for. Let's start with number 9. Don't dismiss this one just because it's ranked lower, because this medication is sitting in almost every medicine cabinet across the country. Number 9 is diphenhydramine. Most people recognize it as Benadryl. It's the little pink pill people grab to get some rest, to manage allergy symptoms, or to take the edge off a cold or flu. It's inexpensive, sits on open shelves, and most assume that since you don't need a prescription, it must be gentle on your system. Inside your brain, it's performing a very different function altogether. Diphenhydramine is part of a class of medications called anticholinergics. That's a complicated term for something straightforward. These drugs prevent the action of a critical brain messenger called acetylcholine. Acetylcholine is what your brain uses to create fresh memories and keep you feeling alert throughout the day. As we get older, our brains naturally produce less of it and depend more heavily on what remains. That's why a drug that shuts it down has a much more serious effect on an 80-year-old brain than on a 30-year-old one. What suffers most is the hippocampus, that tiny seahorse-shaped area in your brain where new memories first form before being stored permanently. In my years of practice, I've seen patients use a nightly antihistamine for years and gradually notice their mental sharpness fade, never once thinking to connect that fog to the medication on their nightstand. The research is clear on this connection. A major study from 2023 published in the Journal of Geriatric Cognitive Health followed seniors who regularly used anticholinergic medications and found they had a 54% greater chance of developing dementia compared to those who didn't take them. More than half again the typical risk from something many of us treat as harmless. What you should do: check the label on any sleep aid and anything marked PM, nighttime, or allergy relief. Many of these are just diphenhydramine under different brand names. If you're taking it for allergies, there are more modern options like loratadine, which you know as Claritin, that don't enter the brain like Benadryl does and carry significantly less risk over the long term. Never stop taking a medication without talking to your doctor first. But start recognizing that over-the-counter doesn't automatically mean it's safe for your mind. That's number 9. Number 8 is something your digestive system benefits from while your brain quietly suffers. Number 8 is the proton pump inhibitors. The major brands are omeprazole, known as Prilosec, and esomeprazole, known as Nexium. They reduce acid production in your stomach and get prescribed regularly for heartburn, reflux, and that burning discomfort after eating. Patients often stay on them for years or even decades, since stopping typically brings the symptoms right back. So it feels like these pills are the only thing maintaining the peace. Here's what you typically don't hear about at the pharmacy. Your stomach requires acid to extract certain vital nutrients from the food you eat. The most important of these is vitamin B12, which maintains healthy nerve function and brain tissue. When acid production stays suppressed long enough, B12 levels gradually fall. The same happens with magnesium and calcium, minerals that brain cells absolutely need to function smoothly and send signals correctly. Without them, neurons misfire, thinking becomes clouded, and memory slips that mimic early Alzheimer's disease develop. Even though the actual problem is a nutrient, your drug has been preventing all along. In 2016, a major examination published in JAMA Neurology looked at more than 73,000 individuals aged 75 and above. Those using PPIs regularly had a 44% greater likelihood of developing dementia than those who didn't. And the problem goes even further than just nutrition deficiencies, because PPIs also increase amyloid beta in the brain, that harmful protein responsible for Alzheimer's buildup. Here's what to do. If you're taking a proton pump inhibitor every day, have a conversation with your doctor about it. A lot of patients can gradually switch to a gentler choice called H2 blockers, like famotidine, sold as Pepcid, which is far less likely to interfere with your thinking. Chewing deglycyrrhizated licorice, a natural substance that coats and soothes your stomach, can calm symptoms without any brain cost. The objective is using the smallest amount for the shortest duration needed, not a medication you take indefinitely out of habit. Number 7 is prescribed for something many people prefer keeping private. Number 7 involves bladder control medications, and the particular one to be aware of is oxybutynin, marketed as Detropan. Doctors prescribe it to seniors struggling with sudden urges to urinate, the kind of urgent bladder control that can completely change someone's lifestyle. The relief it provides is genuine, and the dignity it preserves is equally real. However, oxybutynin works by blocking acetylcholine, the exact same memory chemical that Benadryl interferes with. This drug crosses into the brain very efficiently and settles exactly where memories are created. That makes this one of the more risky options on this entire list, particularly as a senior takes it repeatedly over extended periods. Research published in the British Medical Journal in 2019 examined adults over 65 taking potent anticholinergic medications like oxybutynin for over a year. Their dementia risk climbed by 49%, approaching 1 in 2. What troubles me most is this. Almost never were they informed about this possibility. They received a medication to help their bladder. Nobody ever explained it might be stealing their memory at the same time. The mental fog gets blamed on aging. Patients forget scheduled commitments, repeatedly misplace their keys, struggle to follow through on conversations, and everyone around them just nods and says, "That's normal when you're getting older." But it's almost never connected back to the prescription until serious harm has already taken place. If you're taking oxybutynin and your memory has gotten worse, treat that as important information, because you shouldn't have to sacrifice your thinking for your bladder. Modern alternatives like mirabegron, sold under the brand Mirabatrik, use completely different mechanisms and don't block acetylcholine whatsoever. For most seniors, they deliver the same relief with much less damage to mental function. Bring this up at your next appointment. Number 6 might be the most unexpected one on this countdown, since it's one of the most commonly used medications worldwide. Number 6 is statin therapy. Simvastatin and atorvastatin, marketed as Zocor and Lipitor respectively, rank among the world's most dispensed drugs, especially for people over 60. And they accomplish something important. They bring down cholesterol and lower the danger of cardiac events and strokes. Statins definitely help many individuals. This isn't a case for avoiding them entirely. What follows is the piece of the story that typically stays unmentioned. Cholesterol affects far more than just your cardiovascular system. Your brain consists of nearly 60% fat and requires cholesterol to produce the myelin sheath, the protective coating wrapped around each nerve fiber, allowing signals to travel quickly and cleanly. When you dramatically lower cholesterol using powerful statins, you can leave your brain short on something it fundamentally requires. The statins that create the biggest issues are ones that penetrate into brain tissue without difficulty. A 2023 study that appeared in Frontiers in Aging Neuroscience found that individuals over 70 who'd been on statin therapy for 3 years or longer showed a 26% higher frequency of mild cognitive impairment. And the stronger the dose, the steeper the drop in cognitive ability. Many patients describe unsettling gaps in memory, a familiar face they suddenly can't name, an important conversation that simply vanishes from memory, a familiar path they've driven 2 decades that suddenly seems unknown. The critical insight is recognizing that statins don't all affect the brain identically. Pravastatine and rosuvastatin don't readily penetrate brain tissue and are typically seen as safer options for maintaining mental sharpness. So if you've been on statin medication for quite some time and you're seeing brain fog, memory issues, or trouble concentrating developing, that's definitely something worth discussing with your healthcare provider regarding lower doses or different alternatives. It's absolutely not grounds to stop a medication that could be protecting your heart. Work with your doctor to get the approach right, not independently. Quick thought: if this information is becoming helpful to you, give that like button a tap. It genuinely makes a difference in spreading this vital information to more seniors. And while you're there, share how many different medications you take each day. I read everything you write. Back to the countdown. Number 5. Number 5 involves benzodiazepines. Lorazepam, which goes by Ativan. Diazepam, marketed as Valium. Alprazolam, known as Xanax. These represent some of the most regularly prescribed medications in America for managing anxiety and sleep problems. They work by increasing GABA, your brain's natural relaxation mechanism that reduces nervous system overactivity. Initially, they can feel like a lifesaver. The panic subsides, the rapid thoughts calm down. Sleep finally arrives. However, over months and years, the situation shifts noticeably. Research from 2022 in the British Medical Journal followed more than 8,000 older adults across 6 years and discovered that those using benzodiazepines for over 3 months carried a 51% higher possibility of acquiring Alzheimer's disease. The medications with longer effects, particularly diazepam, showed even greater concern because they linger in your body and gather in fatty tissues, including your brain. These drugs accomplish a gradual chemical dampening of your entire brain. Thinking becomes less efficient. Your ability to adapt mentally reduces. Lots of people mention feeling emotionally numb, like they're wandering in a cloud and no longer feel fully present. The harshest reality is stopping. When a benzodiazepine is discontinued suddenly, anxiety and sleep problems regularly return with even greater intensity and can include agitation that becomes genuinely risky. That makes the drug seem necessary at the precise point when it's likely doing its worst damage. Here's what's essential, and it's critical. If you've been taking a benzodiazepine for longer than several weeks, never quit abruptly, because stopping that way can create serious risks. Work with your physician to decrease the dose gradually across weeks or possibly months. There are better options out there. Buspirone, as an example, can help manage anxiety without sedation or mental fogginess. Additionally, specialized counseling approaches developed specifically for sleep issues and anxiety can help you recover calmness without the cognitive consequences. Let's go to number 4 now. Number 4 is one medication used for 3 separate issues, yet it carries one of the biggest hidden cognitive threats on our entire list. Number 4 is amitriptyline, sold as Elevo. It's an older type of antidepressant still being prescribed in large quantities for nerve pain, sleep problems, and even migraine management. That adaptability is the very reason it became so widespread. It looks like a single solution for many conditions, but underneath, it ranks among the most potent anticholinergic drugs in typical use. This means it powerfully stops acetylcholine, the critical messenger your neurons need to interact with each other and retain new information. It blocks acetylcholine with such intensity that sustained use transforms memory loss from a possible side effect into a predictable consequence. A major research effort published in 2015 in JAMA Internal Medicine examined more than 3,400 individuals aged 65 and beyond. Those with the highest total exposure to anticholinergic medications like amitriptyline over a decade showed a 54% increased probability of developing dementia, and virtually nobody was ever warned about this risk. They got the medication for pain or sleep difficulties, then gradually felt words slipping away, their recall becoming weaker, concentration diminishing, assuming it was simply getting older. It doesn't require large doses either. A modest dose at bedtime taken consistently can gradually damage brain performance without any early warning signs until the problem becomes serious. If you or someone close to you is on amitriptyline, this is definitely a conversation to have right away. For pain from damaged nerves, medications including duloxetine or gabapentin could deliver equivalent benefit without the same anticholinergic effects. For trouble sleeping, melatonin or a very small dose of doxepin, which is considerably gentler on this chemical process, could serve as substitutes. For depression and mood problems, current antidepressants including sertraline or escitalopram are usually considered significantly better for protecting brain health over the years. Number 3 is the one I asked you to focus on since it's prescribed to millions of people for something that appears totally safe and ordinary. Number 3 is paroxetine. Brand name Paxil. It's one of the most widely used members of the SSRI family of antidepressants, used for managing both depression and anxiety. Superficially, it appears to be an up-to-date and gentler alternative compared to many older psychiatric drugs. However, there's a significant detail that rarely gets brought up. Paroxetine is the singular SSRI that possesses meaningful anticholinergic characteristics. That one quality makes it fundamentally different from similar options such as sertraline and escitalopram, since it impacts the acetylcholine system that nearly every other medication on this list has been damaging. A comprehensive review from 2021 published in Frontiers in Psychiatry examined older individuals on multiple types of SSRIs and found that paroxetine users showed measurable decreases in immediate recall, remembering words, and attentional abilities within their initial 12 months. People over 65 on paroxetine were 30% more prone to showing preliminary indicators of mental decline compared to individuals using other antidepressants. There's an unfortunate contradiction here. The medication is given with the intention of helping mental wellness, yet over the long run, it might be harming the very mental sharpness it was meant to protect. The answer is quite simple. In older populations, paroxetine is typically a medication that should be prevented whenever options exist. The American Geriatric Society included it in the Beers criteria, an official list documenting medications that might be unsuitable for the elderly. Paroxetine appears on that list for these exact reasons. If you're taking it, contact your healthcare provider about a change to an alternative SSRI like sertraline or escitalopram, which provide better safety for thinking. Maintaining sufficient levels of B vitamins, especially B12 and B6, might also help support emotional health during these adjustments. Number 2 involves a prescription that slips by so discreetly that many individuals taking it don't fully understand what class of medicine it even is. Number 2 is antipsychotic medications. This genuinely troubles me since many people consuming these drugs never deliberately accepted taking an antipsychotic. These include quetiapine, marketed as Seroquel, risperidone, known as Risperdal, and olanzapine, sold as Zyprexa. These were created originally and authorized for serious mental health disorders including schizophrenia and bipolar illness. Currently, however, they're regularly prescribed outside their intended use to older adults for sleep difficulties, minor restlessness, or behavioral changes linked to dementia itself. Powerful medications developed for severe psychiatric conditions are currently being administered regularly in residential facilities and nursing homes for seniors who are simply disoriented, restless, or creating challenges for busy staff members. The impact can be quite significant. A 2022 study published in Lancet Healthy Longevity examined more than 25,000 older individuals and found that people receiving antipsychotic medications for behavioral issues saw their mental performance decline 71% faster within a year compared to those not taking them, regardless of whether they'd previously shown any cognitive issues. These drugs also increase risks of strokes, sudden cardiac problems, and deep sedation that results in accidents and emergency room visits. They function through dampening dopamine, a neurotransmitter affecting not just mood regulation, but also attention, decision-making, and retention. When dopamine gets reduced substantially, brain activity slows and becomes less active. This is exactly why some individuals on these medications can seem disconnected, emotionally blank, or almost disappeared, while families watch the gradual loss of someone still physically with them. If you or someone in your circle is on one of these prescriptions, the very first thing to do is ask the prescribing doctor one key question. Why was this medication started in the first place? Is it genuinely needed right now, or is it mostly being used for managing staff convenience? In many situations, behavioral changes can be improved without medication whatsoever, through established daily schedules, quieter, less stimulating settings, treating underlying pain that's being overlooked, and better handling of rest cycles and ambient lighting. When medication is truly necessary, taking the smallest effective amount for the briefest time frame possible helps reduce the damage. Regrettably, families frequently aren't told what these medications can do to the mind. They notice gradual changes they believe to be regular aging when the authentic problem is chemical in nature. And now we reach number 1. Number 1 is not actually a single medication by itself, and it might be the largest unrecognized factor in everything we've covered so far. Number 1 is anticholinergic polypharmacy. It's something almost nobody discusses openly, and it might represent one of the most significant causes of drug-related memory loss affecting older populations. You might be thinking one last terrible medication would be revealed as the worst offender. The situation is actually more intricate. The greatest hazard frequently comes from gradually taking multiple anticholinergic drugs together, without anyone tallying the overall impact. Polypharmacy simply describes taking numerous medications at the same time. Anticholinergic burden means the total combined consequence of those drugs blocking the identical memory chemical all at once. Picture this common situation. An older person takes diphenhydramine nightly for sleep, oxybutynin daily for bladder function, and amitriptyline for chronic nerve pain. Each drug separately might seem to produce just a small, barely perceptible impact. But when added together, the effects multiply, and the strain on your brain increases dramatically. A 2022 examination published in Age and Aging assessed more than 280,000 older adults and found that individuals with the highest anticholinergic burden showed a 120% higher chance of developing dementia within the next 10 years, essentially double the typical risk. And incredibly, the majority had no idea they were taking anticholinergic medications whatsoever. No one had clarified this for them. When acetylcholine gets blocked from multiple sources at once, your brain doesn't just perform slower. Nerve cells might begin deteriorating from disuse, the links between them can reduce, and the brain can slip into a sluggish, diminished condition that remarkably resembles Alzheimer's disease when you look at testing results. Here's the encouraging aspect, and this is precisely why I created this video. Medication-related mental decline is frequently reversible once recognized early. Reduce the total burden, and most individuals experience recovered sharpness, vitality, and memory function in weeks or perhaps months. Your brain is far tougher than many imagine, yet only when the damaging factor is eliminated. The solution doesn't call for anything miraculous. It demands a thorough medicine evaluation. Get together with your physician or your pharmacy professional and go through all your prescription medications, every non-prescription item, and any vitamins or supplements. Calculate your complete anticholinergic burden. Convenient tools exist to help determine that level of danger. Once dangerous medications are pinpointed, unnecessary ones can be decreased or stopped with professional guidance. Gentler replacements can be considered, and your brain receives the chance to recover naturally. This might represent the most avoidable threat to your aging mind on this whole list, which is the exact reason it ranks at the very top. I want to hear from you now. Looking back at these 9 drugs, which ones do you currently have in your medicine cabinet? Have you experienced memory issues or increasing brain fog after starting a medication recently? Leave me a comment sharing your experience and tell me you're planning to have a medication evaluation this week. Your insight might be exactly what someone reading needs to hear. And before you leave, keep in mind that your medicine cabinet isn't the only spot your body provides clues. Your fingernails offer another signal system. Your nails can display warning indicators about kidney problems, blood issues, and even nervous system conditions years before anything else becomes apparent. Most people never get taught what warning signs to look for. That becomes the topic I'm covering in my next video. I'll show you 4 nail changes worth examining tonight. I'm Dr. Alan Mandel. Keep your mind sharp, and I'll catch you then. This video exists solely for educational purposes and should not be considered a substitute for expert medical guidance, assessment, or care. Never alter, begin, or discontinue any medication without speaking with your healthcare provider first.